practice questions within the anatomy and diagnostics section of ENT. As always, while we're going through our practice question videos, I would like you to pause the video after we initially review the question and answer options. That way you can independently select which answer you believe to be true, and then I want you to restart the video, and that way we can go over the rationale together. All right, so this is our classic multiple choice style question. It is going to assess your knowledge of physiological integrity. A patient is undergoing a non-contact tonometry procedure in which a puff of air is directed at the cornea for the intention of indenting the cornea. The nurse knows that this procedure is performed to assess for which of the following conditions: legal blindness, myopia, cataracts, or glaucoma. So this is describing tonometry. So tonometry is a test that is done primarily to assess for an increase in intraocular pressure and therefore potential glaucoma. So there is non-contact and contact tonometry, so both of which are utilized to assess the amount of pressure needed to flatten the cornea. In regards to glaucoma, and when we're speaking about intraocular pressure, know that a normal intraocular pressure is 10 to 21. All right, this is a matrix multiple choice style question, and this is going to assess your knowledge of physiological integrity. An experienced nurse is discussing cranial nerves and educating a new graduate nurse on their functions. For each statement, click or specify with an X whether the statement indicates understanding or no understanding of the teaching provided. So when you're reading these statements, are they true or are they false? So cranial nerve 2 is the optic nerve and is directly related to vision. Cranial nerve 3 is the trochlear nerve. Cranial nerves 3, 4, and 6 all innervate eye movement. Cranial nerve 6 is the abducens nerve. And cranial nerve 2 is the olfactory nerve and is directly related to smell. So this is just directly testing your knowledge on the cranial nerves that, were covered when we discussed the eye. All right, so cranial nerve 2 is the optic nerve. It is directly related to vision. Cranial nerve 3 is the ocular motor. 4 is the trochlear nerve, and 6 is the abducens nerve, all of which help to innervate eye movement. So, of course, we will further discuss the cranial nerves when discussing within the neurological system, but cranial nerve 1 is the olfactory nerve and directly relates to smell. All right, this is a drop-down style question where you have separate answer options for each blank or fill in the blank. This is going to assess your knowledge of physiological integrity and then health promotion and maintenance as well. A 51-year-old African-American male with a past medical history of myasthenia gravis presents to his primary healthcare provider for a monthly follow-up. The nurse performs an initial assessment of the patient prior to being examined by the provider and discovers that the patient has been experiencing intermittent episodes of double vision and ptosis. The nurse recognizes that the patient requires a blank to assess for extraocular movements with suspected blank. So you know that the patient has myasthenia gravis, and you know that he's complaining of double vision and ptosis, or drooping of the eyelids. So review your options and see if you can select the correct one. All right, so you should be able to recognize that double vision and ptosis are signs of muscle weakness in the eyes. And then you know that he's presenting with muscle weakness in the eyes. So performing the 6 cardinal positions of gaze will assess the patient's ocular muscle weakness. So with the 6 cardinal positions of gaze, the patient is asked to hold their head in one place and then follow the movement of an object through the 6 positions of gaze. The patient is asked to follow that object in a parallel manner with both eyes. Now, tonometry is used to assess intraocular pressure and suspected glaucoma, and then a slit lamp exam examines the anterior ocular structures and is used to diagnose things such as cataracts. All right, this is a multiple response style question. Select all that apply. Again, this is going to assess your knowledge of physiological integrity. The nurse is providing teaching to a patient that is scheduled for an ENG for the diagnosis of nystagmus. Which of the following statements indicates an understanding of the teaching? So which of the following statements are true and accurate, demonstrating an understanding of the teaching? I will need to avoid eating or drinking anything for at least 3 hours before the procedure. The procedure will only last 1 to 2 minutes. I need to avoid caffeine for 24 hours before the procedure. I will be asked to sit and stare at lights and moving patterns. And it's okay to have water or black coffee prior to the procedure. So which of those are accurate? All right, so an ENG is performed to distinguish between a normal nystagmus and then medication-induced nystagmus, or even nystagmus caused by physical abnormality. So the patient should always be instructed to remain NPO or nothing by mouth for 3 hours prior to the procedure, and then you want to instruct the patient to avoid caffeine for 24 to 48 hours before the test. So the patient is instructed to sit and gaze at lights, to focus on moving patterns and points, and then close the eyes. While sitting, the patient may be rotated to obtain information about vestibular function. You should always educate the patient that this procedure is very long and very tiring. All right, this is a drag and drop style question, and it is going to test your knowledge of physiological integrity. A 78-year-old male patient presents to the clinic with reports of a constant low-pitch blowing noise in the bilateral ears. He reports a recent history of heavy farm equipment operation. Upon assessment, BP is 152/90, heart rate is 88, O2 is 97% on room air, and respiration rate is 17. The nurse comes to the conclusion that the patient is presenting with a problem of the blank, as evidenced by blank. So there are some distractors here in the vital signs, but you have an elderly male patient who has a blowing noise in the bilateral ears. So what is that a problem with, and it's evidenced by what? All right, so tinnitus, or a ringing in the ear or blowing in the ear, is the most common complaint of patients with problems of the inner ear. This is often caused by the operation of heavy equipment, also can be caused by gunfire or shooting a lot of guns or being around a lot of gun shooting, or it can be caused by elevated blood pressure. So, again, a problem of the inner ear, as evidenced by that tinnitus or the ringing and reports of a blowing noise. Reports of burning or itching would be specifically related to problems of the middle or outer ears.